Lab Technician Sticky Notes for Part 1. A-type natriuretic peptide, ANP, 22 to 77 pg per milliliter, SI units, 22 to 77 nanograms per liter * lavender top tube. Immediately sent to lab on ice. Specimen may need to be fasting. Check with lab. Filled square secreted by atrial myocardium, exerts an antihypertensive effect by increasing the renal excretion of sodium and water. Filled square secreted from the atria in response to atrial wall stretch. Filled square less useful than B-type natriuretic. Acid-fast bacillus stain, AFB, * sputum specimen sent in a sterile collection cup. Gastric washings, aspirates, urine, cerebral spinal fluid, CSF, other body fluids, or tissue samples may also be tested. * sputum samples should be induced in the early morning to obtain the best specimen. * collect specimens for 3 days. * tests for Mycobacterium tuberculosis, atypical mycobacteria, or other acid-fast bacteria. See tuberculosis culture. Acid phosphatase, ACP, prostatic acid phosphatase, PAP, 2.6 nanograms per milliliter or 0.5 IU, L, SI units, 2.2 to 10.5 UL, red top tube. * assess prostate cancer metastasis, treatment effectiveness. * infrequently done. Usual test is PSA, prostate-specific antigen. ACTH, adrenocorticotropic hormone, AM, 80 pg per milliliter. SI units, 18 pmol, LPM, 50 pg per milliliter. SI units, 11 pmol, L. * green top tube. Filled square assess signs and symptoms of adrenocortical dysfunction. Filled square sample must be iced and sent to lab immediately. ACTH stimulation test, concentropin stimulation test. Greater than 7 grams per deciliter over baseline in rapid screening test. Greater than 40 grams per deciliter over baseline in 1 or 3-day test. Green top tube. Filled square differentiate between pituitary-induced adrenal dysfunction and adrenal insufficiency. Filled square test involves obtaining a baseline ACTH level, administering concentropin, a synthetic ACTH-like drug, over a prescribed period, and drawing repeat ACTH levels. Antithrombin 3 at 3.21 to 30 mg per deciliter. C units, 210 to 300 mg per liter. Blue or red top tube. * assess patients with thrombosis. * patients with low levels are resistant to heparin therapy. Alanine aminotransferase, ALT. 10 to 35 U.L. C units, 0 to 0.58 millicatals per liter. Red top tube. * enzyme found in liver cells. * used in diagnosis of liver, biliary, and pancreatic disease. Albumin. Adult. 3.5-5 g per deciliter, C units, 35 to 50 gram per liter. Child, 3.8-5.4 grams per deciliter, C units, 38 to 54 gram per liter. Red top tube, main plasma protein, helps maintain osmotic pressure. Decreased albumin causes fluid shifts and resultant edema. Levels decrease in renal or hepatic disease, acute infection, malnutrition, malignancy, diabetes, and many other chronic and acute conditions.